COVID-19, the quick fact. What is COVID-19? COVID-19 is potentially severe viral infection that affects your lungs and airways. Some infected people have no symptoms, but others get very sick, and some people die. What is COVID-19? COVID-19 is caused by a new type of coronavirus called SARS-CoV-2. It's recently mutated from a type of coronavirus that infects bats. What is COVID-19? The virus spreads through the air and droplets that an infected person spread through a cough or sneeze. Through touching things that infected people have touched and then touching your face. Unlike with many people respiratory viruses, you can spread the virus that causes COVID-19 before you have any symptoms. If you don't know of the virus, you can easily pass it on and now know it. There are hundreds of different coronaviruses that all related. Most of them infect only animals. Only a few coronaviruses can infect people. Some of them cause only colds. What are the symptoms of COVID-19? Many people with COVID-19 have almost no symptoms. If you do get symptoms, you will likely have fever, dry cough, trouble breathing, feeling really weak and tired. You may also have runny nose and sore throat, loss of your sense of smell and taste, headaches, stomach problems such as nausea and diarrhea. Is COVID-19 fatal? The older you are, the higher your the risk of death. You at the higher risk if you have other medical problems such as heart disease, high blood pressure, or diabetes. How can doctor tell if I have COVID-19? The most common test uses a swab taken from the back of your nose or throat, which is sent to a lab to talk the virus. To help tell whether you were ever affected, a blood test can look for antibodies your immune system has made to defend against the virus. How is COVID-19 treated? If you have a mild or moderate case, stay home and not go out or go near other people. Wear a mask so you don't spread the virus. If you have a severe case with breathing problems, you will need to go to the hospital. Doctor will give you oxygen, sometimes put you on a ventilator. How can I prevent COVID-19? The best way to prevent COVID-19 is to avoid being exposed to the virus. Stay away 6 feet away from people in public, social distancing. And wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover a coat or nest with a tissue. Then throw the tissue in the trash. Use a household disinfectant spray or wipe to clean things people touch a lot.